been a big part of healthcare, and that's hand hygiene. And, you know, they have always reiterated to us in the hospital setting how important it is to wash your hands in between patients, to wash your hands anytime that they are soiled, anytime you take off gloves. And, you know, back then it was universal precautions when it came down to what, you know, back in what, 25 years ago when it was HIV. And so you had to treat all patients as if they had some type of blood-borne pathogen, blood-borne disease. And so that's what it was. So you always wash your hands in between patients. You wash your hands once again after you do anything that's touching the patient or anything in the patient's room. Well, it's the same way with COVID, and probably more so because you have these droplets that travel in the air. And so that's what the masks are for, is to protect you as well as the other person that you may encounter in the process. So that's why it's so important to wear the mask. And so when I got my results back in on July 2nd, to be exact, that I had tested positive for COVID. And my main thing to my family and to other people, I said, I'm one of the main people who have always, not that I like to wear a mask, but I wear it again to protect myself from others and to protect others from me. And so anyway, I said, of all the people who voice and who promote mask wearing and who advocate for mask to be worn, how in the world did I get COVID? Who knows? All I know is that I work in healthcare all the time, so I don't know at what point or with what patient or with what item I picked it up from, but I did get it. So now more than ever, I am very conscientious of when I go out in public, washing my hands and sanitizing and wearing a mask and social distancing as much as I possibly can. It's almost impossible to social distance in the healthcare setting, though, because we give direct patient care. So with that being said, again, it's important that we do take time out to protect ourselves and to protect others as well. And we have to look at it this way. Think about the people who is actually doing direct patient care in a hospital setting that where these patients are ventilated and they're in ICU. And think about these people that have to have this equipment, this personal protection equipment on for 12 hours. The majority of the time when we wear a mask, those, especially those of you that may not be in healthcare, when you put a mask on, it's to run to Walmart for an hour. It's to go to the doctor's appointment maybe for an hour or two. Okay, so compare that to somebody who's taking care of your loved ones or your family members or your co-workers for 12 straight hours without getting a bathroom break. And I know it's you're probably saying, oh, that's impossible. No, that is not impossible. It is not impossible. Once again, I work in healthcare, and I know what they tell us. Those nurses, when they clock in at 7 o'clock, they don't sit down or they don't go home or they don't come out of that room until 7 o'clock p.m. if they get out then. The 12-hour shifts are turning into 14 hours and turning into 16 hours. So y'all, let's be conscientious and let's be, let's advocate for mask wearing. I don't care what, a political party may say. It's not so much about a political party. It's about humankind. Okay, it's about our fellow brothers and sisters that we want to protect, our children we want to protect. So even as you send your kids to school, I don't care what Malcolm Thomas may say. He may say teachers have to wear a mask for students. Send your kids, if your kids have to go back to school, make sure that they have a mask. Make sure that they have sanitizer in their purse. Please, please, please instruct them and inform them the importance of washing their hands, not to drink behind anyone else, to make sure that they keep their personal things to themselves, no sharing pencil, no sharing pens. Okay, so this is vitally important. And like she said, I haven't encountered many Alzheimer patients or patients with mental illness in these times, because again, I work in an outpatient setting where, I prep patients for surgery. So even if they do have some form of disability, when they come to us, you know, they can't get into the hospital unless they have a mask on, you know, or if it's one of those patients who just, you know, sometimes they can be developmentally delayed until they won't keep a mask on. And we understand that. I mean, that's something that we have to deal with when it presents itself. But I haven't had many encounters like that. So I really haven't had many Alzheimer's patients or many developmentally delayed patients where I had to keep reiterating how important it is to wear the mask. Even our pediatric population, they have been well versed in how important it is to wear a mask. So you have 2 and 3-year-old that comes to the hospital, and the entire time that they're there, from the time they enter into the hospital until, well, right now, not in the operating room, they don't wear, but from all through pre-op and all through the recovery room, they have to have that mask on. So if these kids can do it as uncomfortable as they can be, as adults, I know that we can too. So again, let's be conscientious of the other person, not just so much you. I've known so many people who have lost loved ones through coronavirus. This has been a trying year for all of us. Let's stay prayerful. Let's pray that there will be a resolution to this real soon. In the meantime, take the necessary precautions and do what you need to do.
Okay, thank you so much for joining us this evening. I really appreciate you coming on and just telling us about the COVID virus, because I think a lot of times when it first came out, I think some people thought it was a hoax, that it wasn't real, and that once it started, especially in Florida, our numbers are really, really high.
Yeah, every day.
Yeah, and the Escambia County's numbers are very high.
Mm-hmm.
Yeah. So with that, we do need to be cautious, you know, and every store that we're going to now is like a state mandate for us to have the coverings. Well, my question for you tonight is, with the blue ones, the really thin, the thin mask, is that does that really help, or are people having those? Are they reusing them over again? But those are disposable masks. Is that right?
They are disposable masks. I mean, it's not like having on an N95, but it does offer some form of protection. It's still protecting you. It's better than not having anything at all.
Okay.
So, you know, definitely there are some masks that's I don't want to use the word better than, what am I trying, that provide a greater level of protection than those blue ones that you get in the hospital. But it's a mask. It's a covering. It's still a form of protection. So no matter whether it's cloth or whether it's a hospital grade mask, or it's one that you have ordered from Amazon that's going to give you an added protection with a ventilation system or a one-way valve, as long as you are covered, that's going to minimize your chances for getting coronavirus. And like I said, definitely the hand washing. Right. And I was one of those people when it first came out. I was one of those who said that it was man-made, which I still do believe that it was man-made in China. I most definitely believe that it's a biological warfare, but that's just my opinion, okay? But so when it first started, I didn't think it was going to be as serious as it was. But I think the reason why the United States being such a democracy country, and everybody got a right to something. And so I think that because the democracy, being a democracy country, it has hurt us. Because once again, well, I'm going to go here. Nobody can tell me what to do. I'm going to wear this. Even with the little motorcycle thing that's going on. Have you seen those hundreds of thousands of people that gather together like sardines in a can? Uncovered, hundreds of thousands. It's called Sturgis, some type of motorcycle convention that they're having this week. So imagine the cases that all those people are gonna take. They came from all over the world. So imagine how many new cases that we're gonna begin to see probably in 14 to 28 days from now. Just watch. None
Wow.
of the majority of them, over 95% of them, did not have on a facial covering. Mm-hmm.
Wow.
And
So are they developing a vaccine for the COVID-19?
they are in the process of developing a vaccine. From what I understand, there's more than one. I know Johnson and Johnson, and I think there's a European a company so they got 3 or 4 uh, pharmaceutical companies and scientists that's working on the vaccine.
Oh, okay.
Yeah. Mm-hmm.
And I had one more question for you concerning the stats for Escambia County. With
Mm-hmm.
that, I think that they're saying that it may be a second wave that is coming. Do you think that that's possible? Well, do you think that that's possible that the second wave is coming?
I've heard that from experts as well, and they're saying that the fall is going to be worse than what we had in spring and summer. I definitely hope not. I hope the the vaccination God miraculously, or like 45 says that it's just going to disappear. I hope one morning we do wake up and it just disappeared. I wish it was that easy, and but I've heard the same thing. As a matter of fact, I worked with someone who said that her grandmother had it in March, and she is in the hospital right now with it a second time. So from what I
Okay.
understand, I was thinking that the antibodies, once you get it, the antibodies will forever be in your system, kind of like when you get a chickenpox vaccination. But from what I understand, once you get the virus, the antibodies are only in your system from 60 to 90 days. So after that, there is a possibility that you can get it again.
Wow.
Mm-hmm.
So our prayer is that this is over with, because I know that we lost a local pastor really not too
Yes.
long ago. Yeah.
Yeah. Yes, I heard about that. My heart goes out to his family. So many. And then, last week on the news, there was a mother and her 2 sons.
Yeah, it was.
Mhm.
Yeah.
Yeah. So
So I
people
thank
just
you.
wash up and wash up.
Yeah, because with the well
Stay in as
with
possible.
the hand washing hygiene, if you have someone that you need to really continuously tell them to wash their hands
Hmm.
constantly. And I think for the hand washing, it's supposed to be 20 seconds, or is it the ABC song? If you're speaking to someone on that capacity, would it be the ABC song if that's their concept?
Well, yeah, I know in nursing school, that's what we did. But a good 30-second hand wash and getting in between in between your fingers, your nail beds, underneath your nails. Even if it's just 30 seconds with uh, antibacterial soap, that's fine. It's gonna suffice.
Okay. All
Hmm.
right. Well, thank you,
You are
Mr.
welcome.
Gulley, for spending time with us and letting us know about the COVID virus and what's going on. And we so appreciate the healthcare
Yeah,
workers and all that you guys do and those long days that y'all have. So,
and thank you. And I was gonna say too, again, from being one who actually was sick from the disease, and the thing about it, none of us know how our body going to respond to it. Because when I had it for the first 10 days, um, I from the day I got the diagnosis on the second until like July 12th, about 10 days, I absolutely could hardly get out of bed.
oh wow.
My body ached so bad. It was like the flu magnified by 100. It was absolutely horrible. And so take all of that into consideration. You don't know whether or not you would be one of those people who would test positive but be asymptomatic. You may be like me, one of those people who was really sick. I've had the opportunity to witness and to minister and to talk to so many people since I post that I had coronavirus, and some of us, again, we got really sick. I even talked to a couple of people who had to be hospitalized. One person that I know that had to be on life support. So we don't know how we're going to respond. So take the precautions. Be conscientious, be cautious, and wash, wear your mask, and be safe.
There was one question that I wanted to ask you before we left. When they were saying that some people are asymptomatic, what does that mean?
That means they tested positive for the virus, but they don't have any symptoms of it. They tested positive, they don't have fever, no chills, no colds, no coughing, none of that stuff. So they don't have any symptoms of it at all. And so the day that I started getting sick, when I woke up that morning, I felt absolutely fine. And then I had to be to work at 5:30. So about 12 o'clock at work, all of a sudden, I'm very hot nature, but I just started getting cold. And I said to one of my coworkers, I'm like, man, for the last hour, I just keep getting cold and I can't get warm. So I went and got a scrub jacket and put it on. This was right at noon time. And then about 1 o'clock, I felt myself, almost like the inside of me was on fire. I knew I was getting sick. And I started thinking to myself, oh man. So it went from 12 o'clock, from having chills, to 1 o'clock, having fever, and I had already started having body aches. And I went and checked my temp. When I came in that morning, I think I was at like 97.9. When I went and checked my temp, I was 100.3. So I told my supervisor, I said, look, I just spiked the temp. And she said, oh, you got to get out of here, go to the emergency room, get tested. And that's exactly what I did. And so within 36 hours. So they told me they would have my results in 24, but it actually took about 36. So within 36 hours, they called me and told me that I was positive. But I had already told my husband, because I went from chills to having a fever to body aches to developing cough. By the time I got my positive results back, I had already started having like 8, 9 of the symptoms. So I already knew it was going to be positive, I already knew that, reading up on it and hearing about it. So I really wasn't surprised, but it was just something, and then when I got the results on the second, that night, I lost my sense of smell. The next morning I woke up, I had lost my sense of taste.
Oh, okay. So those are factors in it, okay.
Mm-hmm. So when they say that they're asymptomatic, that means that they didn't have any of that, but yet still they tested positive for the virus.
Okay. So should everyone be tested for COVID, even though they don't have any type of symptoms?
I wouldn't say everyone, because like they said, like they have stated on the news, I don't even think there's enough tests for everybody in America to be tested. So that's why at one point they were just testing if you had symptoms. But I think now, because so many people are getting it, I think now you can just go to any testing center with or without symptoms and be tested. But I wouldn't say it should become, it should not be a mandate or mandatory for everyone to get tested.
Okay. All righty. We thank you so much for joining us.
You are welcome.
And I appreciate you for doing it. We have 2 more speakers for this month. So thank you.
You're welcome. My pleasure.
All right. I'll see you next time.
All right. Thank you.
Bye-bye.